My name is Sharon Galicia, and I'm a neurologist at Everett Clinic. So I went to medical school in West Virginia, which is my home state, and then I did my training at Rush University in Chicago. I also did my fellowship in clinical neurophysiology in Chicago at Rush, and then I started here in 2007. I used to want to be a scientist when I was in college, and then I just realized that being a scientist might be too isolating, and so I like science, I like people, so I went into medicine. Well, I liked neurology from the very beginning. So in medical school, in the first year, we do neuroanatomy, and then I just really liked the different pathways and figuring out the symptoms and how they related to the brain and to the spinal cord. And then when I did my clinical rotations in neurology, I just really like the patients and their stories, and so I decided to go into it. I'm a general neurologist, so I see a pretty wide variety. I see patients with headaches or with multiple sclerosis, movement disorder like Parkinson's disease. I see patients with seizures and strokes, so I see a big variety. When patients come in, I really try to know them personally. I just don't want to know about their disease or their symptoms. I'm really interested, I guess, how the disease affects their life and affects their families and affects themselves. I don't think that a patient should be approached as just trying to figure out what the disease and how to treat it is. I think it's really important to treat everyone as individuals and figure out what's important to them. I think it's important for patients to know that as a physician, we're really trying to work together. And some patients will come in and they feel nervous about coming to me and talking to me about their problems, but it really should be, we really should have a good relationship. And I think any of my patients, I always want them to feel like they can ask me anything that they want and feel comfortable doing so.